In this video, we'll talk about complications of a heart attack. Heart failure doesn't necessarily mean that your heart has stopped beating or working. It's a condition when someone's heart is unable to pump enough blood around their body to meet all their bodily needs. Heart failure can cause many complications to all the body organs and parts because when the heart fails, they are starved of the oxygen-rich blood they need to survive. Areas such as the brain, lungs, kidneys, skin, and nervous system can be affected. The veins in the arms and hands, legs and feet, abdomen, and neck can also be affected, often become swollen. Heart failure can cause shortness of breath, especially when doing physical work, with the amount of the loss or shortness of breath increasing with the level of exertion undertaken. Valvular heart disease. This condition is where the valves in your heart that control the free flow of blood are not working properly. The valves of the heart ensure that your blood freely flows in a forward direction and cannot leak backward. The way in which the healthy heart operates is the same for everyone. The heart contains 4 chambers, with the heart valves placed at the exit of each chamber. Your blood flows from both your right and left atria into the ventricles through the open mitral and tricuspid valves. When your ventricle chambers are full, the valves shut, stopping blood returning to the atria when the ventricles contract. When the ventricles start to contract, the aortic and pulmonic valves are forced to open. The valve from the left ventricle goes into the aorta and then to the rest of the body after passing through the aortic valve. The blood from the right ventricle goes into the pulmonary artery through the pulmonic valve. Once the ventricles have finished contracting and start to relax, both the valves shut, preventing any blood from flowing back. This pattern is continually repeated over and over for the full life of the person. There are 2 main types of heart valve disease. 1. Valvular stenosis, and 2. Valvular insufficiency. Valvular stenosis occurs when one or more valves are narrowed, stiffened, thickened, or blocked. This can lead to the heart having to work very hard to pump enough blood through to the different body parts. All 4 of the heart valves can develop stenosis. The other common type is valvular insufficiency, sometimes called either regurgitation, incompetence, or leaky valve. This happens when the heart valve does not seal or close properly, allowing some blood to be forced or leak back into the chamber. If this condition worsens, it forces the heart to work harder to supply the needed blood to the body. Some forms of heart valve disease are congenital, while others may only be detected later in infancy. Other forms can develop during a person's lifetime. However, the cause is still unknown, but it's definitely linked to inadequate diets and sedentary lifestyles. This form of the condition usually affects pulmonic or aortic valves. Sometimes they can have defective leaflets that are deformed, they're an incorrect size, or not attached properly. Sometimes people are born with bicuspid aortic valve disease. This is where there are only 2 leaflets instead of the normal 3, often causing the valve not to open or close properly or tightly. Acquired valve disease occurs when the valves that were normal at birth and in early life have changed or developed complications. This can occur from a variety of reasons, mainly infections or diseases, including rheumatic fever, caused by an untreated bacterial infection such as strep throat. Often, this type of infection in childhood, if left untreated, can quickly lead to inflammation of the heart valves. Often, the symptoms of this type of infection and irritation do not manifest for 20 to 40 years later. Another heart valve disease is known as endocarditis. This occurs when harmful bacteria enters the bloodstream and then attacks the heart valves. It can result in holes and growths developing, as well as subsequent scarring. This bacterium is often able to enter the bloodstream because of IV drug use, dental procedures, surgery, or severe infections. A very common condition is called mitral valve prolapse. This is a condition that is known to affect about 1.5% of the general population. This condition causes the leaflets of the mitral valve to move back into the left atrium when the heart contracts. It also often tends to make the tissues that make up the valve stretchy, causing the valve to leak. Normally, this condition does not become problematic and does not require treatment unless there are other complications. Another thing that can affect the heart valves are some sexually transmitted diseases such as syphilis. High blood pressure can also contribute, as can many types of drugs, both prescribed and over-the-counter and illicit. Cardiogenic shock is a condition in which your heart suddenly can't pump enough blood to meet your body's needs. The condition is most often caused by a severe heart attack. Cardiogenic shock is rare, but it's often fatal if not treated immediately. Fortunately, about 50% of people who develop this condition will survive if immediate help is available. The most common cause of cardiogenic shock is damage to the heart muscle from a severe heart attack. Only about 7 to 8% of people who have a heart attack will have cardiogenic shock. When people die from heart attacks, it's usually due to the cardiogenic shock, not the actual heart attack. Because of this shock, the body has a very low blood pressure. Another type of shock, hypovolemic shock, is where the heart cannot pump enough blood because of blood loss, usually from trauma. Vasodilatory shock is when the blood vessels relax abruptly, causing blood pressure to become so low that there's not enough pressure to pump the blood to areas that need it. This can be caused by a bacterial infection in the bloodstream or a severe allergic reaction to certain substances. This can also occur when the nervous system is damaged. When someone is suffering from this type of shock, regardless of the cause, it means not enough oxygen is reaching their vital organs. They only have a few minutes before the lack of oxygen starts to do damage that is usually not repairable. If it's not treated quickly, it's likely to cause permanent organ damage or death. If you know or think a person is in shock, call an ambulance so they can get treatment quickly. Do not delay with calling for help or try to transport them yourself unless there is no other option. A blockage in the pulmonary arteries of your lungs is called a pulmonary embolism. Usually, a pulmonary embolism is caused when blood clots from the legs and sometimes other areas of the body, deep vein thrombosis, travel to the lungs. A pulmonary embolism can reduce or block the blood flow to the lungs, becoming a life-threatening condition. With prompt and expert treatment, the chance of this condition resulting in death are greatly reduced. One of the best ways to prevent a pulmonary embolism is to take adequate measures to prevent blood clots in your legs. If blood clots are formed, quickly eradicate them. Arrhythmia is the term given to a condition where the rhythm of your heartbeat changes. This can happen when your heart rhythm is too slow, too fast, or if it has an irregular rhythm. Sometimes an arrhythmia can cause your heart to just stop beating, which is called sudden cardiac arrest, or SCA. If it's not treated immediately, it can cause a loss of consciousness and death. Broken heart syndrome. This condition is named because it can happen to someone who has no history of heart disease and tends to happen quickly. The most common signs of this are chest pains and shortness of breath. Sometimes it's accompanied by a cardiogenic shock or arrhythmias. The other symptoms of broken heart syndrome tend to differ from those of a heart attack. The symptoms occur abruptly after experiencing extreme physical or emotional stress. The results of an electrocardiogram, or ECG, which is a test to observe the heart's electrical activities, are usually different from those who have had a heart attack. For instance, those who have had a heart attack in the past will show a deep Q wave in their ECG graph. When tested, there are no signs of coronary arteries being blocked. There is usually unusual movement and possible ballooning of the left ventricle or lower left chamber of the heart. Usually, the recovery time is relatively quick, often within a few days or weeks, as opposed to a heart attack, which usually takes a month or more. Arteries often harden as a person ages, losing their suppleness and elasticity over time. Although smoking is thought to be one of the major contributors of this condition, the exact cause remains unknown. Chemically derived drugs are believed to be another contributor, along with a poor diet or a diet that contains a large amount of preservatives, artificial flavors, and colorings. Myocardial aneurysm. An aneurysm occurs when a blood vessel has been weakened, causing it to swell and fill with blood. Often these are formed after a heart attack. They often occur around the base of your septum or in the aorta. This can cause a constriction of the blood flow to the body, resulting in heart disease. Aneurysms become lined with scar tissue, which usually stops them from rupturing. Ventricular aneurysms generally grow slowly. The common symptoms are tiredness, lack of energy, and stamina. Blood clots can form inside some ventricular aneurysms, which can lead to serious complications and even death, especially when the blood clots break away and spread throughout the bloodstream. Some aneurysms are congenital while others are caused by a heart attack. The blood clots formed around them can block the blood vessels, resulting in restricted movement and tissue death in a limb, a stroke, ventricular aneurysm, or arrhythmia. In this video, we'll learn about emergency care. So, what can you do if someone is having a heart attack? Oftentimes, there won't be obvious signs of pre-heart attack. This disease is usually asymptomatic until the later stage. Early signs of heart attack include feeling pain or discomfort in his or her chest and shoulders, tiredness, lack of energy, breathing difficulty, and so on. Everyone's complaints might differ, but when heart attack actually happens, one would experience sharp pain on his or her left chest for at least 15 minutes. Men and women have different symptoms. Often women do not experience any chest pain. Their symptoms are fatigue, disturbed sleep patterns, shortness of breath, indigestion, and anxiety issues. If you think you're having a heart attack, call emergency services right away. Do not wait, as every minute counts. A person's treatment options and chances of full recovery can be reduced by the delay of treatment. Call emergency services and talk with the operator who is trained to assist you. The 6 signs of heart attack. So, how do you determine whether a person is suffering from a heart attack? Here are the 6 signs of heart attack that you can take note of. Heart attack sign number 1. Chest pain or discomfort. For men, chest discomfort is the most common symptom of a heart attack. Usually, it's felt as a tight, heavy, or burning sensation. This usually starts in the middle of the chest, then moves to other areas of the body. Sometimes it's continuous, sometimes it goes away and then returns. Some people experience no pain at all, just discomfort or a dull type of pain, which can grow to be quite intense. Others will not have pain, just discomfort. If you think you're having a heart attack, call emergency services right away. If it's only chest pain, the person will still need to see a doctor. Heart attack sign number 2, discomfort or pain in other parts of the body. The symptoms of a heart attack can also manifest in different parts of the body, such as one or both arms, the neck, jaw, back, or stomach. Different people, especially women, will experience pain or discomfort in the jaw or back during an attack. Heart attack sign number 3, shortness of breath. After someone does physical work, it's normal to have some shortness of breath. If this happens when you are resting, it's often a sign of heart failure. If your breath becomes unusual, take a short rest to normalize your breath. If your breathing does not become normal after 2 minutes, call emergency services. Heart attack sign number 4, nausea, sweating, or clamminess. Many people, especially women, when having a heart attack will feel nauseous, excessive sweating, or clamminess. These symptoms can also be indications of the flu, but if these symptoms occur abruptly, or if you also have other indications of a heart attack, call emergency services immediately. Heart attack sign 5, a general feeling of extreme fatigue or weakness. Sometimes the first complaint you may hear from a heart attack patient is general weakness or fatigue. It might not sound like much, but this is a common indication that most potential heart attack patients experienced prior to the attack. But this symptom alone is not enough to diagnose or expect a heart attack, as there are too many causes of weakness and fatigue. It could be due to lack of oxygen, not having enough sleep, poor eating habits, anemia, arthritis, and others. But if other signs of heart attack are present, do not hesitate to call for emergency services immediately. Heart attack sign number 6, collapse or falling. Often a person with heart attack will collapse or lose consciousness, unlike other chest conditions where this rarely happens. Again, if you find someone collapses and lose consciousness, bring him or her to an open area and call for an ambulance right away. Early warning signs of a heart attack. Heart attacks usually give a bit of a warning before they happen, except with heartbreak attack. Often this can happen days or in some cases months before an attack is imminent and the heart muscle becomes damaged. High blood pressure is a sign of possible heart disease. Chronic heartburn can be an indication of heart problems. Reduced cardiovascular fitness and shortness of breath. High blood LDL cholesterol levels. The feeling of being unwell or run down before a heart attack. There are lots of reports of people feeling a sense of impending death before experiencing a heart attack. This is quite common and may have something to do with depression, which is also an indicator of heart problems. Abdominal pain and indigestion is a common sign, especially for people over 55. Because of the similar symptoms in many different conditions or diseases, it can be hard to tell that you are experiencing a heart attack. So, look for several symptoms. The more symptoms you have, higher the chances you are having or will have a heart attack. Routine checkups from your health provider are advisable for prevention and cure. What to do before help arrives. Having a heart attack is a traumatic experience. Often people will panic when having a heart attack, so try to remain calm. If you are helping someone, assure them that help is on the way and that things are okay. It will help calm them. Keeping calm is important. The best recovery position is when sitting in the W position. This is with the back supported at a 75-degree angle and the legs bent so the knees are up and the feet flat on the ground, forming a W shape. Another position that is recommended is to lie flat on your back with your feet up above your heart, the Venus position. This opens your diaphragm, it makes breathing easier, and increases the oxygen supply. Once the person is comfortable, all tight-fitting clothing should be loosened to avoid any restriction, but do not allow them to chill, so ensure the person is covered. It is important that the person does not walk around. Lying or sitting in a relaxed position without pressure on the lungs is best. Do not ask unnecessary questions or distress the person, but do check for any medical bracelet or tags and try to find out if they have any medical condition or are carrying any medicines. If someone is expecting a heart attack, they may be carrying aspirin or nitroglycerin. Usually they will know the required dose. Help them to take a small amount. If a person's heart stops beating, it becomes necessary to start CPR, but it is important that a person administering CPR is trained correctly. If you do not know how to do CPR, then doing heart compressions is the best option. When CPR is administered, as soon as a person's heart stops beating, even before help arrives, the person's chances of survival are drastically increased. What to do if you are having a heart attack when alone? Most people are alone when they have a heart attack. The first thing you should do is call emergency services. Give your location first, then your name, and try to state your problem. Only after you have summoned emergency services should you call others such as friends or family. The emergency service operator is trained to help you in cases of emergency, so follow their instructions until help arrives. If you are completely alone and do not have a phone, there is still one thing you can do that may save your life. This self-procedure is controversial, but it has been suggested that it could make matters worse if not done correctly. But if you are alone and there's no one available to help, then this is a viable option. Take a very deep breath. and then cough vigorously right from the bottom of your chest, the same way a cat will cough to get rid of a fur ball. For this to work effectively, the person needs to take a very deep breath, about every 2 seconds. Breathe in and make a deep, prolonged cough. This procedure has to be maintained until help arrives, or your heart regains a regular rhythm and is beating normally. What this procedure does is to bring a large amount of oxygen into your lungs. The coughing squeezes the heart and keeps the blood moving. This squeezing pressure on your heart at about every 2 seconds will help your heart regain its normal rhythm. By doing this, you should be able to get to somewhere where you could find or call for help.